Okay, so this ring obviously is stuck. You actually injured your hand roughly a week ago. You're walking your dog. There's actually a little tiny avulsion fracture in there. As a result, we did the x-ray before we went to ring removal because of the injury. It actually was seen at another site, and they tried a string wrap technique using an elastic strap from an oxygen mask. Unfortunately, that made the swelling a bit worse. Usually those string wraps tend to do that if the ring doesn't come off. They also tried at the other site to cut it. You can see there's a little tiny nick there where they tried to start cutting it, but this would be a very difficult ring to cut just because it's so long this way. You can't get those little guards underneath, and so it's a bit of a tricky one that way. And it's also really sentimental. You said that it has a couple stones that are from your family or extended family.
Absolutely.
And it's engraved on the inside as well. Which,
that's correct.
Yeah, which gets disruptive with cutting. So the fact that the string wrap technique was done makes it a little more difficult. But that's the case. So we're going to put this on, try and shrink the finger down, and see if we can get the ring off intact.
Excellent, doctor.
Okay, so the ring rescue device is applied there. You can see it's just up next to the ring. So over top of the finger, we're going to get you to raise your hand up for 5 minutes. Okay, so because it's an angry finger, we put the device on for 5 minutes. You can see the seam where it was shrunken. The size has definitely come down. We're going to put on for another 5 minutes. We're just going to rotate the cuff slightly when we do that. So the swelling came down quite a bit there, actually, which is great. We're just cutting to a quick side-by-side before and after comparison. So we're getting pretty close to the point where we can remove the ring. I know it is tender through there, isn't it? I mean, we know that because there's a little tiny bone chip.
Yeah.
So you already at the other site, they tried to do a ring block, and they did that when they tried the wraps. And we can certainly do that today because it will be a bit tender working on the knuckles. So we probably go ahead and put a little ring block in there, and then we'll remove the ring. The ring obviously came off. It's a thick ring, so it'd be actually quite difficult to cut. And with all those embedded stones and the engraving on the inside, this would be a very difficult ring to cut. And so good news is we didn't have to cut it, notwithstanding the fact, of course, that it's sentimental. Okay, so to recap, this was an injured finger. The injury caused a lot of swelling and the ring got stuck, so ring removal was required. The other hospital tried string wraps and cutting. Both were not successful, and the patient was referred to a site with the ring rescue compression device. 2 rounds of finger compression provided good shrinkage of the finger. A metacarpal block provided excellent pain control for the patient during the removal process. The ring was still tight, and ring manipulation techniques required some skill to get the ring off. But between these techniques and lubrication, we were successful. Unfortunately, I wasn't able to record that because I was the only one doing the procedure and couldn't do that and film at the same time. Pre and post procedure x-rays were done due to the fact that there was injury there, and there was of course no change in the small little avulsion fracture post ring removal. The patient was referred on for finger follow-up regarding the injury, and there was a great outcome. The ring was preserved, the ring was removed in the case it was otherwise difficult to cut, and a testimonial from the patient was a great outcome. Importantly, this case involved a difficult ring removal from an injured finger, where I determined that the injury was stable for the purposes of these ring removal techniques. Note that you don't want to manipulate an unstable or severe injury, such as in these examples. When in doubt, x-ray first and seek qualified medical advice, such as from an emergency physician, plastic or orthopedic surgeon. Also, when it comes to any ring removal, consider all options in your toolbox, including ring cutting, and pick the best strategy that matches the situation, including consideration of patient preference, viability of cutting, and your experience with the techniques. One little pro tip to share for any ring removal: pay attention to how the compression device is applied to the finger and next to the ring for that perfect fit. And we're going to finish the video today with a couple side-by-side photos of before and after from other ring removal cases. The ring rescue compression device shrinks the finger to a more manageable size so that you can remove the ring. For more cases, check out the published case report series in the Journal of Emergency Medical Services, and also visit the Ring Rescue website to see how-to videos and the step-by-step guide to get you up to speed with the basics.